Friends, I am Dr. Sujit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Signs, symptoms and uses of Homeo-Remedy Calcarea Phos. Full name Calcarea Phosphorica. Short name Calcarea Phos. I will use this name throughout the video for Calc Phos. This name I will use. Common name phosphate of lime. Source compound chemical words. Sphere of action of Calc Phos. Mainly acts on body parts enriched with calcium and phosphate, that is bone, teeth. Further, it also acts on female genital organ, glands, digestive system of the body. Pathogenesis. Calcarea Phos or Calcarea Phos, whatever it may be, produces a state of defective assimilation as to calcium and phosphorus, leading to improper bone formation, ossification, delayed dentition, spinal curvature and rickets, etc. Constitution of Calcarea Phos. Physical makeup of Calcarea Phos: best suited to persons who are pale, have dark complexion, dark eyes, hair, with emaciated body, sunken flabby abdomen, soft bent bones, enlarged head, long thin neck. Most important point: no long thin neck, enlarged head. Hot and cold, chilly patient. Miasm, psora in the backdrop. Diathesis, scrofulous and gouty. Mental generals of Calcarea Phos. Bad effects after grief and vexation. Peevish, forgetful. Involuntary sighing, always want to go somewhere. This is a very important symptom of Calcarea Phos. Calcarea Phos patients are always on the move. Complaints worsen when thinking of them. Idiocy, agile cretinism. Mind the term, agile cretinism. Cretinism is some sort of very much idiocy, but in that particular disease there is agility in the patient. Physical generals of Calcarea Phos. Defective bone development, tendency of bone to curve. First picture, top. Long bones like tibia, fibula, ulna, radius, etc. Non-union, malunion. Late union of bones fontanelle remains open too long, especially posterior fontanelle. Now look at this picture. This is a skull picture of not exactly fetal. Actually, you can call it a skull of just a newborn baby. There are two points called anterior fontanelle and posterior fontanelle, where the bones, skull bones meet, and that particular portion remain without any bone. Generally, gradually thereafter bone develops and the point are fused. These are called fontanelle. In case of Calcarea Phos, this posterior fontanelle remains open for long time. In case of Calcarea curve, the frontal one remains long open. Mind, this is a very important point for difference. Emaciated babies with sunken flabby abdomen. Idiocy of children. Children very slow to be able to stand and learn walking due to weak ankles. Craving for salted smoked meat, ham, bacon, etc. Dyspepsia when pain relieved by passing wind and temporary relief by eating. Fistula in ano, that is anal fistula. Alternates with chest symptom. This is one of the most important symptoms of Calcarea Phos. Alternates sometimes chest symptom, that is lung maladies, some sort of lung maladies, then it subsides, fistula ano comes. When it is treated, it goes into subsided, and this chest complaint again arises. This is a alternate. Chronic hydrocephalus. Hydrocephalus means big head. Picture as given later. Head, abnormally big head. This may be used as a preventive remedy for ladies who previously gave birth to hydrocephalus babies. It is some sort of familial trend. A particular lady, if give birth to a hydrocephalus baby, she may do the same in the next time also. So you can give this particular medicine, Calcarea Phos, during the pregnancy stage of the lady to prevent baby being delivered as hydrocephalus. This is a Calcarea Phos baby, sunken flabby abdomen, but otherwise weakly and thin neck. Physical genital calcarea phos continue. At every moment to eat, there is colicky pain in abdomen, numbness and crawling sensation in different organs, for debility or anemia remaining after acute disease. Very important symptom after acute disease. Some patient has suffered from typhoid or said acute dysentery, and thereafter his debility and anemia are not removing or very difficult to treat. So you can give calcarea phos. Better biochemic, give biochemic for a prolonged period and it will go. Trembling or trembling of hands with other complaints. Complaints or soreness in spot like vertex the top of the scalp, eyeball, tip of the nose, fingers. Sensation of crawling and numbness after bad news. That is nervousness. Peevish, flabby, anemic children have cold extremities and weak digestion. They start convulsively when lying on back, but better when lying on sides. You can get this type of patient in a chamber. The mother will report that the boy very much start with convulsion when lying on back. You ask him to better lie on him sides, so it will come down automatically. They lose breath when they are lifted, that body, that baby. If you lift the body above, suddenly they lose their breath. Discharges albumina, shifting, pains, arthritis, rheumatism, mal-assimilation, rickets, Addison's disease. Addison's disease is a multifaceted diseases. Here is the common symptoms of Addison's disease I have given here. Please note out here: hair loss, blurry vision, abdominal pain, decreased appetite, darkening of skin, shaking or tremors, and finally depression. This is Addison's disease, and all this combination can be treated in a particular medicine, that is calcarea phos, because this is Addison disease symptoms. Girls show in maturation effects of taking cold during first menses. Diabetes with lung affection. Mind this symptom: diabetes with lung affection. Moralities of calcarea phos: worse, exposure to cold weather changes, drafts, that is cold wind, cold, melting snow, dentition, mental exertion, loss of vital fluids, puberty, fruits, motion, thinking of symptoms, lifting, ascending. Better in summer, warm, dry weather, lying down. Head symptoms of calcarea phos: aches in occiput, down spine. Better from cool bathing and sneezing. Headache of school children with diarrhea. Burning, worse near region of suture. Suture means suture actually the skull bone. There are joining. There are joining on the skull bone. There are 8 skull bones. There are joining of these bones. That joining are marked by crisscross lines. These are called suture. Delayed closure and reopening of fontanelle. Fontanelle already I have given referred to. Skull thin, soft, crackling like paper. Worse near occiput. Cold and sore vertex. Head hot with smarting at the root of hair. Sensation as if ice in occiput. Depression in occipital bone. Hydrocephalus. Look this hydrocephalus. Look at the head of this particular baby. This is hydrocephalus. In a hydrocephalus patient, there are much CSF in the brain area. There is a particular area in where CSF is accumulated. They runs a particular area. That particular area, more amount of CSF is there, and that for that reason this hydrocephalus happens. This is surely a disease, but within the normal range, it can show some normal symptoms, no matter. But this medicine is a nice medicine to stop this. Skull thin, soft, crackling like paper. Skull bone so thin and soft that is cracked like paper. Worse near occiput, cold, sore, vertex, head hot with smarting, the root of the hair, sensation as if ice in occiput, depression occipital bone. Hydrocephalus cannot hold head up, it wobbles due to heaviness of the heart. Eye symptoms of calcarea phos: cool feeling behind eyes, as if something is there. That there means the eye. Diffuse opacity in the cornea. Look how the diffused opacity in cornea. You will get your patient in the chamber. This is the corneal opacity. You must know this is corneal opacity, nothing else, and you can give directly calcarea phos for that particular disease. Don't without being hesitated or without being perplexed, because you know that if you know the thing, if you do not know this is corneal opacity, you may fumble what to give. But if you know this is the picture of the, for that reason I have collected some pictures and so are showing you. Ear symptom of calcarea phos: sudden swelling of external ear, cool feeling in the ear, noises in the ear after stool. Nose symptom: deep icy cold. Polyp. Polyp means actually polypus. You know polypus. This is a plural form of polypus. This is the polypus in the nose. Pedunculated. Pedunculated means there is no stalk. Coryza with salivation. Coryza with salivation. Face symptoms of calcarea phos: pale yellowish earthy, full of pimples, cold sweat on face, upper lip swollen. Mouth symptoms: retarded dentition, teeth soft, decay easily. Complaints: during teething, convulsion without fever. Actually, complaints during teething for this particular some problem, calcarea phos is universally known. But calcarea phos is not for particular that symptom. There are hundreds and thousands of symptoms. You can check. Convulsion without fever. Teeth symptoms: teeth sensitive to chewing, disgusting taste on awakening, worse in the morning, bitter taste with headache. Throat symptoms of calcarea phos: sore aching in throat, pain while opening the mouth, tonsils and adenoids enlarged. Look at this figure. These are tonsils. These two are tonsils. And adenoids are at the level of nasopharynx. That is not ordinarily seen. You cannot see it with open eyes. You need some instrument, or sometimes it goes so big that it looks behind this nasopharynx and looks in the nasopharynx. I mean oropharynx. Direct in the oropharynx you can see tonsils, but in this level lies the adenoids. You cannot see generally with open eye, unless it is so large that it comes behind this area to be seen in the oropharynx area. Stomach symptoms of calcarea phos: infants like to nurse always, vomit always. They always suckling mother's breast and always vomiting. Craving for raw, salty, piquant food, ham, salted, smoked. Abdomen symptoms of calcarea phos: colic at every attempt to eat, flabby, sunken abdomen, oozing of bloody fluid from navel of infants, festering navels. That is, festering means ulcer that is not healing. Tendency to diarrhea from juicy fruits during dentition. Stools foul, hot, lienteric. Lienteric means containing undigested food particles. Splattering, watery, green, slimy with fetid flatters, as if something alive in the abdomen. This is sensation. This is sensation. Fistula in ano. Already I have mentioned this. Alternating with chest symptom in tall, slim children. Tall, slim children are calcarea phos patient. Hemorrhoids, oozing watery fluid all the time. That is very important symptom. Hemorrhoid, oozing watery fluid all the times. Urinary symptoms calcarea phos: urine increased with sensation of weakness. Pains in the region of kidneys get worse from blowing noses or lifting. Pain in bladder worse when empty. Male genital symptoms of calcarea phos: stitching in perineum extending to penis. Perineum is the region more or less 1.5 inch or maybe slightly more than 1 inch between root of the genitalia and the periphery of anus. This region is called perineum. This is very sensitive region. Erection while riding on a carriage without desire. In the carriage, while in a carriage, there are so many symptoms arises in calcarea phos patient and also nitric acid patients. Weak feeling in sex organs after stool. Craving for raw, salty, piquant food, ham, salted, smoked. Female genital organs. Female genital symptoms of calcarea phos: menses early, scanty every 2 weeks, may be excessive with bright red blood. Mens in girls too late with dark blood. Sexual desire increased before menses during lactation, abnormal craving during pregnancy, burning albuminous leukorrhea from one term to next, that is period, voluptuous crawling in genitals, prolapsus uteri in debilitated women, worse while passing urine or stool during menses with rheumatic pain, uterus heavy, weak and aching, child refuses breast, being milk tasted salty. This patient will come to you, the mother, and he will report to you as a doctor, sir, please help me. My child refusing my breast. My breast is full of milk, but she or he is refusing. Give him Calcarea Phos. The salty taste will of the milk will go, baby will take it automatically. Skin eruption worse during menses, late menses with backache, mammy sore feel large, tumor in left breast of male, painful on pressure, male breast. Respiratory symptoms of Calcarea Phos. Child loses breath on being lifted off. Cough better from crying during dentition. Involuntary sighing. Phthisis with cavities, night sweat, yellow expectoration. Pain in chest from drafts. Must scrape mucus from larynx by hawking before singing or talking. Obstinate whooping cough. Heart symptom of Calcarea Phos. Dropsy from heart disease. Palpitation with trembling, weakness in calf. Neck and back symptom of Calcarea Phos. Neck painful from drafts. Neck weak, thin, head ovals. Curvature of spine to the left. Violent pain, worse from less effort. Screams with pain. Sacrum numb, lame. Lumbar vertebra bent to the left. Spina bifida and Pott's disease. Spina bifida, I have shown this here. This is spina bifida. Actually, this is a problem in the formation of spinal cord. It is congenital in nature, generally requires surgical intervention. Sometimes medicine may act, and that medicine is Calcarea Phos. Calcarea Phos. And Pott's disease is tubercular spine. I mean spinal tuberculosis. Spine bone, when spine bone is affected with tuberculosis bacteria, tuberculum bacteria, rather, that then this disease results. This is called Pott's disease. For both these thing, spina bifida and Pott's disease, Calcarea Phos is the only medicine in our homeopathy. Extremity symptom of Calcarea Phos. Rheumatism in cold season, fingertip sore as of a splinter under nails, buttock numb, weakness through hips, hip joint disease. Hip joint disease as shown here. Actually, this is arthritis of the hip joint. Arthritis of hip joint is commonly known as hip joint disease. Cold limb with digestive trouble, pain, burning along edges of nails, hard bluish lump in axilla, trembling of hands and arms with many symptoms, fistulous ulcer in ankle joint. Sleep symptoms, Calcarea Phos. Constant stretching and yawning. Children cry in sleep, cannot get waked up in early morning. There are a lot of children, boys, girls who cannot get up early in the morning. For them, Calcarea Phos is the medicine. Give them Calcarea Phos 6x every day, 2 doses for 1 or 2 or 3 months continuously. Then this particular trouble will be off. Fever symptoms of Calcarea Phos. Easily chilled, chilly with pain, chills up the back, but heat down the back. Note the symptom, chills up the back. That is, when chill moves, it moves from bottom to upward. Heat moves from down back. This is from chill up the back. Chills up the back, heat down the back. It is coming down, it is getting up. Sticky, sickly sweat, worse around head and neck at night. This is Calcarea Phos characteristic. This is this sweat, head, neck, night. Complementary, Hipar, Ruta, related medicine, Carbonimelis, Sina, Ferrum Phos and Natramur. With this, the video ends. Thanks for listening and viewing. got any problem regarding this commentary, please write in the comment section. I would certainly respond.